and thanks for joining us. My guest today is Raj Vavilala, the Chief Sales, Marketing, and Product Officer at G.E.H.A. Raj, thanks for being here.
Thank you, Terry. Thank you for having us here.
2025 was a tough year for federal employees. A lot of uncertainty, a lot of upheaval. What do you most want folks to know as they start January, maybe with new health and wellness resolutions? What's the most important thing you want them to hear at the beginning?
The challenges of 2025 have resulted in companies taking feedback very well. And all insurance companies are now looking at, what do they offer into the new year to solve some of the challenges that all of our members faced in 2025. So 2026 is a fresh start. Look at all of the offerings that now you have part of your wellness toolkit. Look at all the tools that companies have provided to look at how to manage your health and wellness, and then take advantage of them.
Let's start with some of those tools. So someone made it through open season, maybe they just rolled over their health plan, or maybe they picked something new. Where should they start to set themselves up for success?
The plan documents. Anytime we buy any product, we tend to research it a little bit. You bring home a new car, you bring home a new television, you look at the manual, look at the remote, you look at the features. Health insurance, we don't. We generally go forward to using it. But it'd be really beneficial to take a pause to say, okay, what are your benefits now? Whether it's preventive care, can you take advantage of them now? What are the new innovations that have been done on your member portal? How can you better manage your health, be given the tools that you've been provided? So that's the first thing. Start with your plan documents to see what you have. Log into your online portal. See what changes have been made there. You may have a plan that has some rewards that reset. And the faster you complete some of those activities, the faster you get those rewards. So go ahead and do that now. A lot of times what I see is people wait for a while and they're like, look, I needed to get 2 dental cleanings in a year, but now I'm in July and I can only get 1. And I might have a reward that will only come through if you have 2 cleanings. And so get started on it now. Start with the plan documents right now.
Are there some overlooked benefits or tools maybe that can make managing healthcare easier?
Wellness benefits are generally underutilized. Everybody gets free wellness benefits. They're covered. Things like flu shots. Generally, people don't use them. And so those are all benefits that are baked into each of the health plans that have been offered. Take advantage of them. And when it comes to online tools, one of the most important tools that people need to look at is the provider directory. The provider directory is a wealth of information, not just on who's available, but whether they're taking new patients, whether they're accessible, where are they expanding new offices to. So take a look at that tool and make sure that you put that in as your favorite, if you will. So you're not stumbling when you really need something and taking the time to find it faster.
What about digital tools? Are there new ways that people use digital tools or apps to engage with their health plan?
Everyone has an app or a tool that's whether it's website oriented or an actual app on a phone. They all have tools and the different modules to it. One of the most important advancement has been allowing members to put electronic health records. So start documenting what's happening. Because whenever you go to a new provider, new physician, the first thing everybody starts with is your history. How nice would it be if you can just forward a link to your health record or just export it and download it? That's a tool that's available for most health plans. Take advantage of that.
So we talked a little bit about how folks get onboarded with a healthcare plan and maybe how they organize themselves to take advantage of them. Another topic that gets talked about a lot is mental health programs. And we started this conversation saying how tough 2025 was. There was a lot of stress for a lot of folks. Talk to us about mental health care benefits that may be available to folks through their health care plans.
2026 is going to be really important for taking care of not just our mental health, but our family's mental health. One of the big changes that's occurred in 2025 that is now going to be part of the normal course of life is going back to work. A number of us are back in the office, and that changes routines, and that adds new things. Now you get the chance to socialize with colleagues in a different way, but your routine is disrupted in terms of whether you are picking up your kids from school and you're unable to do that now. whether you're dealing with work stress in a personal, in-person way, and you don't have the opportunity to reset in your house and take a walk and throw catch with your dog. You don't have that. So taking care of your own mental health, your wellness becomes really important as you reset because it's change. And anytime change happens, the first place change happens is in your mind. Your physical activities follow. So really taking care of the mental health benefits, and a number of carriers do have virtual mental health benefits. So check in for yourself, but also for your family. How are they feeling? If your child was used to you dropping them off at school, and now they no longer see that, how do you set that? How do you have that conversation with your child, especially if they are young, to not really understand the concept of dad or mom is going back into the office? What does that even mean? Because office was the corner room. And so how do you have that conversation? What are the right triggers to use to have that conversation? How do you help them understand? And then when you come back, your routines change. Maybe now you have to plan more when you have to do things that were kind of obvious, like making lunch for your child. You could have done it from home anytime. Now you have to plan for that. So really taking care of your mental health while you take care of your children and your family, it becomes really important.
What are some of the typical resources that healthcare plans might offer to support mental resilience and mental health?
Online tools, specifically tools that help you talk to somebody through a screen, are really important. And there are a number of articles that people like us have already gone through to say, here's how I have navigated this particular situation. So check the portal, search for the tool, but really talk to somebody to say, okay, here's what I'm dealing with. How would you propose? And in some cases, in many cases, you may have EAP benefits, and where you're going through a situation that's a little bit more challenging and it's no longer preventive care, that you actually need some intervention. Take advantage of your EAP services that you have to actually schedule time and talk. And a lot of these services can be accessed by a family. So maybe the couple needs to have the conversation in terms of, okay, how are they dividing duties of house and work and childcare, and take advantage of that. A lot of times people address a situation when there is a problem and they have to deal with the problem. Highly encourage check-ins periodically before there is a problem to see how are we going to collectively navigate the situation we are facing now.
That's good advice. And I want to ask you for some different kind of advice here, because one of the topics that's been in the news is increasing healthcare premiums. So folks may be facing a pretty significant increase as they're onboarding their new healthcare plans in 2026. What strategies do you recommend for folks to help stretch their healthcare dollars without sacrificing quality of care?
Get in the game early. Healthcare premiums have risen the last 2 years in a row, and the increases this year have been rather large for most carriers. That's because a number of new drugs are coming in, a number of new benefits are coming in, and the yield of these benefits will be many years down the line. Better weight management, for example, will result in better condition management because we'll avoid a lot of conditions that higher weight causes, but that'll be years down the line. So we are right now in the cycle of higher medical trend. So the best way to take advantage of it is to get in the preventive care right now. So if you have a primary care physician, get with the primary care physician right now to manage your condition or prepare for things that are occurring. And if as a society we invest in well care more than we invest in sick care, I think we'll be better off. That is the only way, in my experience, that we can control long-term trend, because we can have great physicians, we can have great hospital care, but they're always dealing with it when there is an issue, and deal with it beforehand, before there is a problem. And the best way to do it is to actually have a primary care doctor, somebody who has your best health interests in mind and can look at all of your medical reports, all of your physical reports, and suggest a plan of action, not just for this year, for the next 5-10 years, because that's the only way we control trend, that a 5-10 year cycle. And insurance companies, very honestly, have to do a good job investing in well care. And that's part of creating tools, creating benefits, making it easy to be accessible. And if you do that, if the insurance company does that part, and if the member takes advantage of it, we will be in a better spot to manage trend. Because right now, as you said, it's very high.
One of the other ways folks manage those premiums is choosing high deductible plans. and then maybe pairing them with a health savings account. What is your advice there?
The high deductible healthcare plans, especially using HSAs, we have the triple tax advantage. And a number of people know some parts of it, but maybe not all of it. Most members I talk to know that they can pay using their HSA card. If they go to a hospital or a physician and they use it for their copay, they do know that. A number of members that I interact with sometimes get surprised to know that the monies that are contributed to it are tax-free at the beginning, because especially if it's an employer-funded plan, it's taken from your payroll and you haven't paid taxes on it. Taxes are deferred. So, and if your employer is contributing to it, that's a bonus money for you, and then that's also tax-free. And if you're a savvy investor, you can actually invest that. And you can do this for years. If you're somebody who's looking at an HSA plan, an HHP plan as a savings vehicle, you can save your receipts and then use that at some other point of time to withdraw funds while letting your funds accumulate in the first few years and actually have the advantage of the triple tax deferred plan set, which most people don't generally use.
It's a lot of complication. Maybe let's try simplifying something. And that's, you've talked about preventive care already. What are some of the things that individuals can do without medical intervention, or maybe without even engaging their healthcare plan, to help protect their health and their mental health?
Get a good sense of where your current biometrics are, everything. So, what's your resting heart rate? How much sleep do you get? What's your blood pressure? What's your blood sugar level? What's your vitamin, nutrient, and if you have any deficiencies around it. Get a good profile of where you are in your biometrics at a cellular level. And once you get a good sense of that, you can plan for what do you need to really fill up the gaps, if any. So a number of us are aging. And as you age, time becomes short. You make choices on diet and nutrition. And now there are other benefits that companies have wherein you can get a meal service for the type of nutrition that you want. And it's faster. And the days of meal planning are taken care of by someone else if you are willing to take a chance on some of those benefits. So getting your current biometric profile right and understanding where you are and what do you need, and then working maybe with a dietitian to begin with, before you even go to a primary care doctor, working with a dietitian and talking about ways to improve your core health before you go to a physician. Because most of the times when you get to a physician, you're in treatment mode and you talk about drugs and you talk about these medicines to manage certain things. Whereas we all know that your diet, your sleep, your stress levels have more to do with your long-term wellness than any medication you can take now.
There's a lot of talk about touching grass, getting out into nature. There's a lot of talk about community building. You yourself have written about that as well. What should individuals be thinking about to sort of reorient around connection, community, even nature?
Knowledge is everywhere, and trusted sources are really what you need to disseminate. What does this knowledge mean to you, and what do you do to act on it? Having community helps you wherein you can learn from each other, shared experiences. Something that I find fascinating when we do the Learn to Swim programs, kids teach other kids. And their other kids are very open. When a kid comes to somebody and says, do this, hold this, the other kids are open. And as we grow into adults, we are generally not talking about how can we help each other in normal context. But with our friends, we are very open. So community is a way wherein you can explore different places, wherein you learn different things. So if you're in an exercise community, it's easy. But there are other communities around mental health, other community, and a lot of them are offered through online tools by your insurance carrier. So connecting with community gives you that reinforcement and that support that this has worked for someone else, and you are more likely to take a chance to try it for yourself. So engage in communities, especially now that we have so much information. How do you know who to trust? And try, get into various activities, bring your family along, and start to expand your horizon on what you can see and what you want to test.
You've really been talking about a well-rounded approach to wellness here, what the individual is responsible for, what their primary care doctor is responsible for, how the health care plan fits into all of that. Are there ways that healthcare plans can support social and emotional well-being beyond traditional, maybe office-based care?
Health insurance carriers, the advantage that all carriers have is they have more information than pretty much anyone else because of the claims that they process and the information that they have on all of the biometrics that a person goes through. Health insurance companies need to continue to put these sets of information in digestible bite size because nobody can take a whole set of this is what happens to you between age 50 and 55 and plan for all of this. That's a lot. But a health insurance company can give a package to someone to say, here's what you think about when you get into it like you're 51. Health insurance companies generally do a great job at milestones in terms of 65, turning 65. There are a ton of turning 65 programs because we know that Medicare kicks in there. But there aren't that many, you're an empty nester program. How do you manage going from a house that's maybe for 4 to now 2? How does that impact your financial outlook? How does that impact your mental health when you all of a sudden, if you're a mom who's raised a child for 20 years and all of sudden the child's now in college? Health insurance companies know that what happens to somebody who's going through that empty nester phase. And we need to do a better job taking those information sets, putting them into digestible bite sites, creating communities around them, and then making it easier for people to look at it. Any health insurance company, if you go to, there are so many menu items on their website. And now you have to navigate. And this is where health insurance companies need to do a better job. We all need to do a better job saying maybe we just put natural language searches and nobody has to think about anything. Just go in and the website might just be a big search bar. And then you just type in, I am trying to deal with X. Do you have any information on Y? And if we can curate that science-backed, evidence-based, and say, here's what others like you have done, and by the way, here's a community link that you can just silently browse through and take a look at other feedback that's been provided. Now you're in a more informed state to actually act on it. That should be the goal for health insurance companies. We spend a lot of time with network design and benefit design and we should do all of that. But we also need to invest in making sure that they're actually useful for members.
So if you could leave listeners with one piece of advice as they start the new year, what would that be?
We're all on the same page at this time. Nobody set out to solve a problem without the assistance and support of others. We cannot solve this on our own. Insurance companies cannot solve this on their own. Members cannot solve this on their own. Hospitals, nobody can solve this on their own. We have to collaborate. We have to collaborate. We have to be clear on the feedback. So members, their responsibility is to be clear on feedback. One of the best ways is every company does win surveys, loss surveys towards the end of the year. Give your feedback, engage in those surveys and say, here's what I really want from you as the insurance company. That feedback is really vital because as soon as the new year begins, insurance companies now jump into planning for the new sets of capabilities, products, benefits that we do. This feedback is vital, so we have to do that. Members have to do that. What insurance companies then have to do is act on it. Do something about it. The information that you have, act on it. And then members, it comes back into a cycle. They look at what the insurance company is doing about it and see if they're actually listening to you. Are they actually doing the things that are valuable for you? And this is the only way to hold each other accountable. Collaborate and hold each other accountable to make a better system.
I'd like to thank today's guest, Raj Vavilala, the Chief Sales, Marketing, and Product Officer at G.E.H.A. I'm Terry Gerton, and you're watching Federal News Network. For more information, visit federalnewsnetwork.com and search G.E.H.A.